Hello, I'm Elle, and I'm pleased to join you today. Thank you all for having me at this plenary session. And today I want to talk about transgender justice from an intersectional perspective. Um, I want to do this talk so that we can move towards an integrated vision of liberation that centers the most vulnerable. It's my view in doing so, we can more productively engage in work that moves us toward equity for everyone in the transgender community. I want to preface my talk with a consideration of my own positionality. I'm a Black trans feminine person, and I'm also an academic researcher. So implicit to everything I'm presenting is that academic research is a useful tool for justice. But there are other paths in grassroots organization and other roads that people have taken that often integrate with research and are equally important, but might not be addressed as well by this talk. And so the goals of this session, I want to start kind of sitting in the discomfort of this dissonance I've observed in messaging around urgency and transgender advocacy and what research efforts are really prioritized. And then I want to talk about what is intersectionality and what does it tell us about gaps in our research and advocacy. And then I want to wrap up with some guiding principles for intersectional transgender justice from my perspective. It's commonly understood by the attendees at this conference that violence facing Black and Latinx transgender women, particularly Black transgender women, is one of the greatest injustices in America today. These pictures are just some of those women, but according to the Human Rights Campaign, at least 36 other transgender people were killed, and among those entire 44, 28 were Black. It should be noted that this is undoubtedly an underestimation in the ways that transgender people are often misgendered in news reports, go missing without a record of death, or are generally discarded by society. As advocates and scientists, it is common to use this disheartening phenomenon to galvanize support for transgender health equity overall. And reasonably so. Many of the pathways that mitigate adverse health among trans people, economic deprivation through employment discrimination, healthcare and insurance discrimination, and interpersonal and structural transphobia are integrated in precipitating the violence against these women. But I think the challenge and the discomfort comes when you juxtapose this call to urgency that it often uses the plight of Black transgender women with what we see demonstrated in our research priorities. And so I'm citing some now very dated data, a 2002 study that showed 15% of studies on LGBT issues mentioned race and ethnicity. At that time, we were really just reaching what I think of as like the modern renaissance of transgender research and seeing a proliferation of those studies. But even still, a recent National Academy of Sciences report, outside of the context of HIV and STI work, there was very little data that centered the entirety of health for Black and Latinx trans folks. And so today, even, the US Path oral abstracts with the professed theme of intersectionality, anti-racism, diversity, equity, and inclusion, only one of the oral abstracts, by my estimation, actually explicitly centered Black and Indigenous people of color by Dr. Ethan Cicero, who I encourage everyone to attend their talk. And so what does this mean? First, I want to visit this exception and kind of dive into a little bit more, HIV in the transgender community. Transgender Black and Latinx people are centralized in studies of HIV and other STIs in transgender health research. This is reasonable. This figure is adapted from a meta-analysis by Bakason and colleagues that was published in the American Journal of Public Health in 2019. It estimates the prevalence of HIV in different substrata within the transgender community. And you can look at the figure and see this sort of harrowing disparity. Just for context, the overall prevalence of HIV in the entire overall is 0.4%, but you can see among all trans people, it's around 14%. And this is a meta-analysis, so it's no single study, it's synthesized across several studies. But when you look at Black women and Hispanic women within the transgender community, you see 44% and 26% respectively. And so what that means is that Black and Latinx trans people are in many ways still living in the context of an HIV epidemic And so efforts spent there should be continued. However, by focusing so disproportionately on this single axis of health, in what ways do we recapitulate harms of systemic racism on this community? Black and brown bodies are stigmatized and over-sexualized, and by focusing on this only domain, this single domain of health, or so disproportionately on it, I don't want to erase the work that other people have done outside of this, my own included. But by focusing here, to what degree do we reify that stigmatization and over-sexualization? Black and Latinx trans people are not simply reservoirs for HIV, but work needs to be done to focus on how we experience other aspects of health. And also looking at this figure, you'll note that Indigenous folks are not represented at all. And that's because there wasn't sufficient data reported in other studies to support that calculation for the meta-analysis. And that's something we're gonna revisit in this talk. But we need to reckon with who else is erased in discussions of transgender justice. And so when you see these disparities across multiple social identities, the thing that immediately jumps out to me is intersectionality, which is what we're here to talk about. If you've ever heard me talk, you're probably familiar with this quote. But intersectionality is a term coined by legal scholar Kimberly Crenshaw in 1989 in some seminal essays. And intersectionality is an aspect of critical race theory of which Crenshaw is one of the founding scholars. And so I want to sort of center with words from Crenshaw's mouth. Intersectionality is a lens through which we can see where power comes and collides, where it interlocks and intersects. It's not simply that there's a race problem here, a gender problem here, and a class or LGBTQ problem there. Many times that framework erases what happens to people who are subject to all of these things. And this really encompasses what I like to emphasize when I'm discussing intersectionality, that it's about power and that its utility is that it can prevent some of the erasure of people who lie at multiple axes of marginalization. And intersectionality has a rich scholarship, and it's very well characterized and discussed and debated even actively now. And so it would be beyond the scope of this talk to give a full treatment of that. But I do want to give you a brief introduction to some of the core principles. The first one is that contextual and interacting social identities. Contextual means that social identities are constructed through a historical, geographical, and dynamic process, and that social identities interact. My transness interacts with my Blackness, interacts with my fatness, and all of these aspects of myself. The second one is that they are multi-level power structures. And so we have macro level structural axes of systems of oppression, like racism and classism, which stratify people within those social identities of race and class. And you have that on the macro level, structural level, on like communities and neighborhoods and states and nations. And you also have interpersonal level power structures when different people who have different social positions interact, and those power hierarchies come into play there. The next one is mutual constitution, and also say simultaneity. Simultaneity, they're saying the same thing, essentially that these identities are experienced at the same time, or put another way is that these oppressive forces are actually composed of each other. So racism is composed of transphobia and classism, and that you can't extricate them. They actually operate together. And then the last one is an epistemological implication of like where knowledge comes from and who should be centered. And you'll hear that this is a recurrent theme of this talk, but it's centering historically oppressed groups. And there's this rich debate about whether or not intersectionality, which at its core is really about justice, can be adapted to academia. I think the debate and the methods development around that is fruitful but futile. Academia does not necessarily lend itself to justice. So while I use this as a tool, I don't expect it to recapitulate the core principles of intersectionality with perfect fidelity. So the main reason why I think this tool is useful is to uncover those things that we're erasing. And that's gonna come up again. If you Google intersectionality, you'll see a lot of pictures of word clouds where people just talk about their different identities. And I think those are useful, but I think many of them miss the point. These are from two separate papers that I actually like a lot. The reason I like the left one is because it takes those social identities and first of all talks about processes, not race, but racialization. And then it contextualizes them in those structural oppressive things. So it's not about race, it's about racism. It's not about being disabled, it's about the process of ableism. That's what the oppressive force of ableism. And the second one is in the context of motherhood and HIV, and it talks about, and it shows how these different structures collide to create a specific vulnerability for Black mothers, and how that leads to a lot of the challenges and disparities that come in Black motherhood and HIV. And so these are two examples of where I kind of think of as intersectionality kind of presented in a way that really captures a lot of those core belief systems. And going back to a lens to see what those who are erased. On the left is actually a screen grab of a paper led by a lot of transgender researchers, many of you who will know those names, who were responding to an international HIV/AIDS conference that largely presented research that didn't include transgender scholars, which led to problematic, erroneous, stigmatizing work. And in this, they say transgender HIV research, nothing about us without us. And they're speaking to their exclusion from this field. And I think that's such a powerful statement, but I also think it's also an indictment of ourselves in a way too, because nothing about us without us actually has its origins, by my understanding, in disability rights movements. And this paper from 2019, this book by James Charlton was published, I believe, in 2002. And talking about disability oppression, and along with the Indigenous community, I think the disabled community is one that is largely neglected in our discussions of our advocacy, our research, and our agendas for moving towards transgender health equity. And so this is, I say, a road to transgender health equity, because the reality is there are many more roadblocks, but I wanted to just demonstrate sort of my vision of how all these intersecting systems of oppression interact with transphobia and are barriers that we ultimately have to address before we can reach transgender equity and liberation for all of us. And so state-sanctioned violence in the carceral system, that's the bedrock, that's what the Black Lives Matter movement is about, the disenfranchisement of Black people through the mass incarceration and the violence that is sanctioned against us by the police. And that disproportionately affects Black people in a way that and Indigenous people specifically. Actually, a study showed that 4 times fatal police killings are 4 times as high among Indigenous people relative to white people, and about 3.5 times higher among Black people. So it's important to note that with those one of the most severe manifestations of that phenomenon is actually amongst Indigenous people. But unfortunately, we don't have good data collection metrics to understand how that affects Black trans people. But anecdotally and theoretically, we can imagine how it's probably even worse and even a bigger barrier for them. And the next block that I present is criminalization of sex work and substance use. And that's more obvious. Sex work is one of the major means of economic survival for some groups within the transgender population. It's one of the ways that Black and trans women who experience, and other Black trans women and Latinx trans women and other trans populations who experience economic discrimination find a way to subsist in America. And also we know that substance use is disproportionately high amongst trans people. And so these are just 2 examples, but another thing is, like, we talk a lot about access to gender affirming care, which is an aspect that is like lots of procedures, but medical procedures and things that are expensive, and getting healthcare coverage and things like that. But the reality is, what does that look like for our Indigenous trans siblings who are often seek care in the grossly underfunded Indian Health Service? A study done by, I think it was the Native American Congress. It was a group of Indigenous or Native governance, and I don't want to misquote what that was, but it showed that you would have to double their budget to even get to the point where they were having the amount of care given to prisoners in the United States. And so that is just, so the discussion of being able to have some of the surgical procedures that we focus on, that we need for gender affirmation, is far downstream from even basic health care that is not being provided in this context. And then another group we'd often forget is disabled trans people who are often, in the context of being neuroatypical, not, their gender identity is often treated as a symptom of their neuroatypicalness, or they are not deemed cognitively proficient enough to actually express a gender, transgender identity. And so these are all barriers that manifest as blockers for different sects within the transgender community. And so for us to get to true equity, we have to break down all of these things. And that's really what I'm trying to demonstrate with this figure. And so with that, I want to go into what I think of as four, there are probably more, but four guiding principles that I think about for transgender justice from an intersectional perspective. The first one, it relates to some of that epistemology that I talked about with respect to intersectional and critical race theory, and that's centering the most marginalized groups in deciding research and advocacy agendas. So who sets our agenda? Who decides where we put our energy? Right now, 2021 has probably been, 2021 has been a record-breaking year for legal attacks on trans people. These numbers were from a Human Rights Campaign press release on May 7th. So it's undoubtedly underestimating the number of bills, but we have at least 35 healthcare bans, 69 sports exclusions, and 43 religious refusals that have been introduced into legislation, with several bills actually being signed into law. And so we rightfully so, as a community of allies, co-conspirators, or actually just members, are responding to these attacks by people who are choosing weaponizing trans health for their political agendas. And that creates this environment where some of our research agendas, or some of our statements, or op-eds, or policy groups are focusing on attacking or responding to these things. And that's important, that's something we should do. But to what degree are we allowing these political opponents to actually dictate what we prioritize? How much is our vision being decided by what they say we can't have versus what we dream of having? And so that's where I think we run the risk of excluding people, because the reality is those attacks aren't rational. They aren't organized around anything other than hate. And so if we spend our time responding to them, our agenda isn't rationally constructed in a way that actually alleviates oppression for everyone. And if you think about it, we're talking about sports, and we're talking about healthcare, specific elements of healthcare like puberty suppression and procedural aspects of transitioning. But how much of our trans community is actually at a point where those elements of their lives are the most pressing element that they need addressed? How many people, and how many of the people will actually have access if those bills are turned over? Like, how many disabled people, or how many indigenous folks, or how many homeless people in the Black trans community will actually be liberated in that respect by allowing people to have access to sports, and by getting these bills against trans healthcare removed. And so I'm not saying that those efforts aren't warranted, but I'm saying that they're incomplete, because there are other elements that we need to address. And that's by not allowing our oppressors to set our agenda and being responsive, but by being visionaries and prospective and building out what we think we deserve. And that kind of gets at what I want to say. And this basically comes down to thinking of trans community as the source of knowledge and setting our research agenda, as opposed to being responsive. And then the last element of this that I want to add is centering the most vulnerable, marginalized groups isn't meant to line us all up and say who has the most pain, the most oppression, and then just let that be what we focus on. It's not a competition in that respect. And it's not also about talking about vulnerability in a deficit-based approach, but I'm really advocating for is a strength-based approach to health justice, and one that considers how we have to respond to all systems of oppression. And since strength-based approaches where we identify elements of these marginalized groups that are able to actually foster their own liberation, these aren't new. And they're actually been talked a lot about in the global health context. The framework here that sort of lists the different flavors of strength-based approaches was actually laid out by Bryant and colleagues in the context of Indigenous health. And so there's sort of 3 levels, and the first 2 really are very individualized, where you think about resilience, like how can an individual and their skills, attitudes, and coping strategies help them respond to some noxious stimuli like discrimination in the context of healthcare or really anything. And then the second one is the socio-ecological one, and that one really brings in these strength-based approach brings in a person's local environment. What are their neighborhood resources, and what degree do they have like family and community support, and also cultural practices that might facilitate health. And that is still individualized because thinking about how a single person operationalize the resources in their environment, or how they might benefit individually from family support. And the most, I think, developed and rich strength-based approaches, as enumerated by Brian, are these social cultural approaches, which are talking about collective strengths and abilities, shared knowledge dissemination, interventions by communities, and like social capital that actually comes from these marginalized groups, which is something you don't think about in terms of social capital built into those groups. And I think of like the barbershop health interventions that you see in the context of Black cardiovascular health, where they partner with communities and empower them to be their own community health workers in an environment that they are at home in, and it has a lot of cultural richness like a barbershop. And here the emphasis is actually on the power of networks. And I think this is an approach that, as a trans person, I know that a lot of we take care of ourselves and our community through these sort of strength-based social cultural approaches, in the sense that, like, when we're learning how to transition, we go to members in community. When we're learning how to be safe in specific environments and different elements of how we need to navigate the world, we go to community. There are Black trans elders who are the main source of knowing who is likely to hire the trans girls in our community in Philadelphia. And so that's what I mean by this like social cultural approach that centers these marginalized groups and that looks at them as the source of both knowledge and strength. And I think the transgender literature as a science as a scientific community, we're behind on strength-based approaches. And so I wanted to bring in examples from other fields. And so this is the work of Dr. Ijoma Opara, who focuses a lot on Black girls and drug use. And these are just 2 screen grabs of papers of hers that I think exemplify a very strength-based approach. And on the left, she talks about how actually having political engagement and viewing yourself as somebody who can impact policy in your environment is a mediator to reducing third-day drug use among Black girls, and also talking about parent education around drug use being preventive. And the latter one might be obvious, but this is sort of, she's one of the few people who I know who's building an entire research agenda that takes a vulnerable population, but focuses exclusively on their strengths and how those can be operationalized for their health. And I think this is a powerful way of re-envisioning research that can lead to policy, that can lead to advocacy, because you identify potentially sustainable pathways that empower the community. The second guiding principle is that representation is a moral and scientific imperative. I think the moral aspect is something that we talk about, and there's a lot of tension in trans research, specifically around cisgender researchers in transgender health. And so when I think about the representation as a moral imperative, I think about research on versus research with versus research by. And so the reality is a lot of the groundbreaking, a lot of the early work in transgender health, specifically around HIV incidence and prevention, was done by cisgender researchers. And that work was useful. That research that in some ways founded elements of our field. But we're at a point where there are lots of trans scholars who are capable of helping to lead and to do research with, and then ultimately guide these initiatives. And it's naive and it's unrealistic to separate the altruism that might be baked into an individual's motivation for supporting the transgender community through a career in academia from the benefit they get from extracting their career livelihood from it. By having this robust research agenda studying trans people, individuals, often cisgender individuals, can create a niche that allows them to move along the tenure pathway. And this is all the product of academia being nested in a capitalist society. And so altruism aside, extraction is happening, and so it can't continue without elevating. And when I say elevating, I mean that is empowering transgender scholars who are available to do that work, but also partnering meaningfully with transgender community lay people and redistributing wealth. And so that means compensating people at a rate that's more than just a $15 gift card, but reasonably compensating them for inclusion in your studies. And I've seen some good examples of this. Kelly Duchesne actually just hosted a Four Corners event where she assembled trans scholars and I don't know specifically about their gender, where Kelly, Dr. Duchesne, assembled a group of trans scholars and also trans members and paid them at a reasonable rate to actually develop strategies and to discuss how to move forward transgender research agendas. And so I think that's the moral obligation. If you're extracting, you have to elevate and you need to redistribute those resources. There's also a scientific imperative. The bottom line is that research that is on transgender people is better when it's inclusive of transgender people, from the construction to the decision to do it, to how it's executed, and to how it's interpreted. Though every step of the way, trans people have vital insights that are necessary to do the work the best way possible. And when you think about intersectionality, I've had multiple people reach out to me to help them try to find a way to increase their recruitment of Black trans women, as a Black trans feminine person myself. And so that means implicitly that there's some recognition that part of the research enterprise is improved by including these people. And so I think we need to push that further, because including trans people also decrease inadvertently stigmatizing work that can be harmful when not interpreted properly. And we've seen this in the context of historical HIV transgender research, which was largely, as I mentioned, done from a cisgender perspective. And a lot of those study designs would make sort of implicit assumptions about transgender anatomy and sexuality that I think honestly held the field back from including transgender women who have sex with, only thinking about transgender women who have sex with cisgender men, and constructing study cohorts based on that inclusion criteria sort of denies the range of transgender sexuality. And so you're not really capturing the full extent of risk behaviors that might be related if we're using a risk framework. And then the risk factors would only include receptive anal intercourse, which again is making assumptions about transgender sexuality and anatomy, and how we would choose to use such an anatomy that is ultimately not really evidence-based. And as somebody who has done work on HIV, I find myself having to navigate a muddy evidence base, navigate muddy literature to be consistent with the past, but also moving in a direction that's actually more consistent with the trans experience, so we can get to better understanding of some of the social structural drivers of HIV prevalence in the trans community. And so both the moral and scientific imperative both necessitate greater representation of transgender scientists, activists, and lay community members in setting advocacy and research agendas that will ultimately drive our goals forward. The next guiding principle is embracing complexity. Embracing complexity. And so I already mentioned that there is a lack of racial reporting in transgender health that was documented in 2002, but anecdotally as an observation has not progressed much since then. And another thing that happens is that we lump a lot of people into the other race category when we're talking about racial disparities or racial inequities in the transgender community. And this makes me think of work by Dr. Tukufu Zuberi on white logic and white methods. Our study of race and racial stratification is dictated by white supremacy, and our methods to address it is also dictated by white supremacy. And what I mean by that is that both in what we decide is a valid race category is historically defined by the white gaze, and the idea that other race is a meaningful way of categorizing a group of people is because other is something that is not white. But if you interrogate what that is looking at, you're grouping a bunch of individuals who have different relationships with systemic oppression, specifically systemic racism. And so the category has no meaning in understanding race as a social construct and how racism could impact those people's health inequities, because you're grouping people who might be white Cubans with indigenous people. And our methods, our statistical approaches are sort of built in this white supremacist society. And so we use rationales from sample size and methods and lack of convergence of statistical models as a reason for doing this. But what that does, it implicitly devalues minority people. So the marginalized and the marginalized don't get centered in our studies. And I mean that we are lumping in indigenous people consistently into this other group. And so it contributes to this global erasure of indigenous folks from population health in general, and that's recapitulated in transgender population health. And I argue that this is this direct result of systemic oppression, even in the way we construct our models, where we have the white group as the reference group. All of this centers white supremacy, is dictated by white supremacy because we center whiteness in it. And so we have these hard to reach narratives around people who use drugs or people who experience homelessness and why certain groups aren't represented in a study. And that those narratives localize blame to the individuals as opposed to structures that create those inequities and practices that lead to the exclusion from research. And so I want to push back on this approach of, one, the other race category. I think it should just be abolished, honestly. And then two, the idea that small sample sizes or poor representation in your study is an excuse to completely erase a group, because that is just contributing to erasure. And so I've already kind of touched on this, but one thing that's in our toolkit, rather than relegating Black and Latinx and indigenous people to the limitation section as we didn't have enough inclusion, so we didn't talk about them, I would say complicate your study. Use descriptive studies with granularity rather than collapsing data to accommodate more robust methods. It's only deemed robust because statistics, which are predicated on being developed in this white supremacist society, are elevated above description. And this is from my experience, both as a statistician, I love statistics, but I recently did a study on police brutality, and there was this tension around small sample sizes getting in the way of, for Indigenous folks, getting in the way of us doing the easiest or the most appropriate model. And me and my co-authors, we went back and forth on that and ultimately chose the more complicated, messy study, and which has been used and cited and has empowered Indigenous people to be able to advocate for themselves. And so that's the downstream impact. We as researchers have a specific skill set that is upstream, admittedly very upstream from advocacy. There's so many steps between research and actual policy change, but it is in some ways a necessary step. And so if we erase them upstream, we limit their chances downstream of being able to advocate themselves. And then another way of embracing that complexity is thinking about multifactorial structural interventions as necessary to achieve health equity. And so a lot of times we think of intervening at a single point, but for these complex issues that are fed by multiple elements, if we're responding to systemic discrimination, by definition, it permeates every aspect of society. And so we need to have interventions across multiple studies or across multiple presentations of work that get at these large structural issues. And I think that oftentimes we spend work on trying to simplify a question to something that is tractable for a research study or a grant, as opposed to pushing the academic funding agencies and the field as a whole to accommodate the complexity of the real world. And the last one is, my last guiding principle is cross-movement coalition building. I've tried to touch on throughout this talk on different ways that trans rights interact with other movements. And I think if you're taking up this intersectionality framework and thinking about how systems of oppression are co-constituted and mutually and simultaneously experienced, then it means you have to also look at a holistic approach to liberation that cuts across a lot of these movements. And so if we really want to help Black trans people, we have to think about prison abolition at the same time as we're thinking about gender affirming care. If we really want to help disabled trans people, we have to think about disabled people's rights and autonomy at the same time as we're lobbying for sports inclusions. And if we really want to help, if we really want to have true identification gender markers for Latinx trans folks, that also means we have to, or Latina trans folks, we also have to think about immigration policy and making sure undocumented individuals are treated like humans in our country. And with that, I'll wrap it up on a note on strength, resilience, and power. I started with a very harrowing figure about Black trans people and being brutalized and murdered. And I want to end on how strong we are and how beautiful we are. We have people like T.S. Madison, who has turned her career in sex work to being a powerful advocate and artist. Miss Peppermint, who's both an artist and an activist, and was the first Black trans person to start to originate a role on Broadway. Miss Major Griffin Gracie, who has been instrumental in liberating Black trans people who have experienced prison and incarceration system. And these are just some of these many beautiful, powerful women. Thank you.